Great way to wake up this morning. It was so beautiful. Ashiana and Pam, thank you for putting that together. Wow, I have a huge smile and so many memories from that. Thank you, thank you. Again, good morning, everybody.
Good morning, Jeff. Thank you so much for coming together on this very special, momentous platform, I would say, making history. So this is the first ever inaugural HCP Cure Blindness Fellows Reunion and Workshop. 27 years of such amazing memories, but action that comes behind it. And I think that there is no one that can set the platform for us better on a worldwide scale when it comes to global blindness as the ones we have here today, Jeff, Tabin, and Sanduk Ruit. You both have been role models, not only in the HCP family, but around the world to ophthalmologists, ophthalmic nurses, optometrists, medical students, residents, fellows who have not even worked with you. And today we celebrate 27 years of excellence, of great work and contributions, and togetherness. And so with that, I hand it over to Dr. Tabin and Dr. Ruit to give us the keynote address.
Well, thanks so much, Ashiana and Pam for putting this together, and really everyone. You know, I see there are 56 people on the call now, which just warms my heart so much. I'm just going to give a little bit of semi history. I think most of you know a lot of this, but you know, back in as late as the 1970s, the standard of care throughout the world was removing the whole lens and using thick aphakic glasses. And that, you know, thanks to Harold Ridley discovering that polymethyl methacrylate from a windshield of a plane remained inert in the eyes of a pilot from the RAF, led to the interocular lens. And by the 1980s, interocular lenses were fairly standard of care. Interocular lenses were fairly standard of care throughout all of the more developed and wealthier countries in the world. But for the poor, the lenses were costing $300-400 and absolutely prohibited by the cost. The standard of care was, you know, really fairly crude with loupes, ICCE, and then aphakic lens. And the person who really changed that for the developing world for so many millions of people were the people who really changed that were Sanduk Ruit and Fred Hollows. And they came up with a concept that you could make a lens less expensively in a low resource country like Nepal. And most of what we do in our realm in America, and I still see it today, is try to see how can we make the surgery 0.1% better, even if it's 100% more expensive. And the one really great mind that was focused on how can we deliver the exact same quality, the very best outcomes to the poorest of the poor at a cost that's affordable, was Sanduk Ruit. And I was just so fortunate after finishing my residency in the United States. I'd already had a little bit of a fondness for Nepal from my realm in the climbing world. I was able to get a fellowship with Hugh Taylor in Melbourne, Australia. And during my fellowship year, Hugh sent me over to work with Sanduk. And we went on an outreach cataract camp. And I was really blown away by what Dr. Rui was able to develop. And not just in terms of a surgical technique for the surgeon, but in terms of human resource development and the way he created a team and the way the team worked and training at all levels and people really, everyone working up to their potential. And one thing that's kind of amazing and phenomenal is now 27 years later, that initial team that I went with to my first trip with Dr. Rui, we went to the town of Jiri. 90% of that team is still together, which is just fantastic. And having this whole community, and each of you on this call are such integral parts of the team, and really looking to how can we overcome world blindness. The name Himalayan Cataract Project came when, after I left Nepal, I came back to my first faculty job in America at the University of Vermont. We were looking for a name for getting a 501c3. And at that time, there was still almost a 250,000 person backlog of bilateral blindness from completely treatable cataracts in Nepal. And virtually no one doing cataract surgery in Bhutan, no one in northern Pakistan, no one in most of mountainous India, and virtually no one in Tibet. And so we called it the Himalayan Cataract Project, thinking it would be kind of a lifetime before we got any sort of control just of the cataracts in Nepal and Bhutan. But time slowly went on, and we started, this is a fellows reunion. We started doing subspecialty fellowships through, Hugh Taylor, through Sandak and my connections in Australia. We were able to get first, Rita Gurung came and worked with me on a sandwich fellowship in cornea. And then we had Govinda Padal go off to Australia, as well as for a retina fellowship, Rohit Saiju for oculoplastics, Suman Thapa for glaucoma. We had a fellowship for a wonderful young doctor named Jaya Thakur to become the first pediatric ophthalmologist. And then that led to this incredible core at Tilganga that began really delivering not just world-class care, but also world-class training. So the whole level of ophthalmology began coming up so fast in Nepal with the advent of subspecialties. And it wasn't just the training of the doctors, it was also the nurses, the technicians, and that's really led to quality care emanating around the world. And we began slowly kind of moving more in the realm of mountainous Asia, and increasing fellowships, increasing access to and quality of cataract care, but also quality of nursing, of ophthalmic technicians, ophthalmic assistants. And then in 2006, another person who I was so fortunate to meet and I missed so much was Alan Crandall. And I need to just say a little bit about my love for Alan Crandall. He was one of the most wonderful people. And I'm so sorry many of you may not be able to meet him. He fortunately passed away way too young a couple of years ago, but he had been working in Africa, and I came to the University of Utah at the Moran Eye Center to join Alan, and we began working in Africa. And now, instead of sending people to Australia for our best fellowships, we began sending them to Tilganga, and also to some great places in India, our wonderful partners like Aravind and LV Prasad. But Tilganga really has been the core of taking the incredible subspecialists, which now, by the time 2006, we began having subspecialty fellowships in at Telganga that were absolutely world-class, we began sending our best African young doctors and young nurses to Telganga for fellowships. And it's been such an exciting thing to see, because now we've started our first line of fellowships in Africa, and everything is kind of leading together. The quality of care has really emanated throughout Nepal, not just Telganga, but several great systems, and several of the people who trained at Telganga are moving outward, and we're seeing the same spread in Africa. And it's just been such an incredible privilege for me to work with so many, brilliant, young, enthusiastic doctors, nurses, and technicians who are really the ones who are at the core of training and changing the quality of eye care for your own countries. My first, I don't know if he's on the call, but our first full African fellow, John Nikarukie in Rwanda. And now there's a full training program with all the subspecialties we've just started in Rwanda. So it's just been such a great thing seeing how things have slowly emanated from, initially two brilliant doctors, Sandak and Fred Hollows, thinking we can give the best possible cataract care to Nepal, we can build a lens factory, to now really full integrated systems. And the problem is still daunting. We still have 16 million people on our planet who are blind from cataracts. But the exciting thing is, as we're working, and we all know that every person we treat is no longer a statistic. They're cured 100%. And so I just got back actually from my first trip to the Philippines, and we did 1,347 cataract surgeries, but I also worked with figuring out how we can start corneal services in the Philippines. And it's all happening, and it's all happening because of every one of you. And I personally want to just say how honored and privileged I am. And I want to thank every single person on this call, all 73 of you, for what you do every day. And now I'll turn it over to Sandak, who will say a few words about what we hope may happen in the future. And then I'll look forward to hearing some of you. And I'm excited that we can have this group, and we can all support each other and work together. And I look forward to the time when we can have this reunion in person. And thank you so much again, Ashiana, and thank you, Pam.
Mm-hmm. Great. Jeff, can you hear me? Good. Good evening here in Nepal, and Jeff, Matt, Ashiana, Pam, and everybody who's listening to us. Jeff has given a very nice backdrop. And I think it's indeed a historical, even if it's a virtual, but it's a historical meeting with all our fellows. And I just want to get to more concisely on HCP TIO training programs, and a little bit on HCP, the homeworks that Pam has given me. And if I look back at some of the achievements of our training programs that Jeff has mentioned, and Jeff, you have been very hardworking, very committed, very persistent, and you're engaged. Personality has been enabled us to move forward, and similarly, Matt. But I think just to look at some of the achievements we had, I think our training program is a little different than other training programs, and I would believe that it had been very sturdy. It was very practical, and there was great appreciation for the kind of trainings and the outcomes of the trainings from these countries and trainees. And the trainings were problem-based, and results were found to be very good, and there was no confusion about it. But some of the drawbacks that we had from our trainings. If you look back, I think we must agree that the trainings have not been, it could be made more systematic, and we could have done better follow-up. And I think we could have planned in a better way. Some of the things that I think we should, we should look at when we move forward. And for example, I think we should still stick to some of the practical aspects that we are good and unique. And, for example, we look at things like maintaining the flow and the rhythm of OPD and surgical patients. And this is not very well written in academic papers, but we do this because it's so practical. Steps, production line steps of both surgery and OPD. And it's very important to study the screening camps. I think screening camps are still very important, and we should try to, sort of forge to see how best we can make it still smarter and still better, and still very productive. And in Africa and many parts of Asia, screening camps are still very, very important, a productive screening camp. And I think we should be focusing a lot on inventory and maintenance. And, the other aspects are anesthesia and protocols, especially after the COVID. I think protocols are very important. And sterilization, I don't want to mention that so much. And operating room counseling. These are some of the things that we need to break down. And I think we have all agreed that we need to do a better follow-up. I think a follow-up, mentor-assisted follow-ups, and timing of the follow-ups, duration of the follow-ups, and resources checking for the trainees. Very important thing, I think. And finally, in our training programs, I would, following this this meeting of all the fellows, I would propose, especially to Jeff, Matt, and Pam, and others who are listening, I would propose that let's have a very good working workshop. Let's have a workshop on our training programs to address the clarity of the purpose and see how we plan. If we have a strategic management plan, or subjects, number, country, curriculum, stakeholders, methodology, impact, and finally, if necessary, budget. I mean, that's just a suggestion that I think we should have a workshop really. And I'm quite happy to host here in Nepal. If you all think it's that's really something that I would feel it's probably important for such a important, the work that HCP is doing in terms of training, fantastically important. And we have the impact that we have produced in many parts of Africa and a lot of Asian countries too. I think the trainees, but we could do better. And just to one more homework that Pam has given me is to, I want to summarize about HCP. HCP had been a beautifully successful, passionate group of people running a fantastic program. And time is pushing us for growth. And this is where, I think how big to grow, how corporate to become. And as we grow, as we become more corporate, we'll have to follow systems, we'll have to follow regulations, and we'll be patient. We have to become patient. And I think the value of passion is going to go a little bit down. So I just want to, share you that I'm sure there's a need for growth, but let's grow very carefully, But again, what a wonderful evening. And, I'd like to say extremely warm greetings, especially the ones who have been to Tilganga. And let's hope they can come back again, or we can come and join somewhere. But I like to thank all the faculties, the people who have been involved and engaged in TIO, because training program is very, very tough. And the trainers need to engage all the time. And one of the good things that has happened now in Tilganga and its, fraternity of hospitals, for example, Golcha, Janakpur, Surkhet, we have nearly 40 ophthalmologists. And combined, we have nearly 100 ophthalmic assistants. We have about 20 optometrists. So I think it's a great pool that we can offer to HCP for, we've been talking about sending people to Badar and other places in Africa. And I think we are ready. We just have to make it more systematic. And this will happen, and there's nothing to worry. So we want to do, especially the hospital in Badar, we want to do it in a very nice way, so it becomes a model for others to see. And maybe at some time, the Himalayan Cataract Project needs to think a little bit about how we can have smart, efficient paramedics coming out in great numbers in Africa. I think that's so important. I don't know the situation in Allah, and maybe Jeff and Matt knows more about it, but I think we need to have paramedical people trained in large numbers and who can be part of the system of high volume, efficient, high quality, eye care. Once again, thank you very much, everybody. And Ashiana, I'm finished.
Dr. Rui, thank you so much. That was very, very, very educational. And Dr. Tabin, Dr. Rui, in your busy schedules, thank you for taking time to be here today. I think one of the most important things that we can take out of today is the idea that you both have, with every breath, you have dedicated yourselves to curing blindness. It is not just something that you talk about. It is something that you dream about, you believe, and that is how you have breeded so many children. These are all your children. All these fellows are taking away your inspiration and have become who they are today. And so I was reading an article recently where Dr. Rui, you were called the god of sight. And you and Dr. Tabin have been the most influential ophthalmologists by the ophthalmologists, by so many other ways. The ASCRS has recognized the work of HCP through the Humanitarian Award and so many other recognitions. But I think it is the action that speaks louder than words. And the two of you are role models for that. So thank you. Thank you for your words today. We are going to move forward to hear from the fellows themselves. So we have 4 fellows. Each of them are going to take about 5 minutes to share a little bit about their walk, their journey to where they are today. The first fellow, or I should say prior fellow, is Dr. Seth Lartey, who was the first fellow in Ghana and has now come out to be the chair of the faculty of the Ghana College of Physicians and Surgeons. He trained in in FACO and in cornea under Jeff and Matt and all the other docs that used to come to Ghana. And he has really led the way in outreaches in Ghana and really taken Ghana to the next level. So without further ado, I hand it over to Dr. Lartey.
Yep. Thank you very much, Ashiana. I'd like to just show our experience in Ghana. I did an anterior segment and cornea fellowship. And my first experience was in 2006 when I met Jeff Tabin, and he introduced me to the SICS technique here in Kumasi. And so in 2006, November, that same year, he sent a team of us, myself and 2 nurses, to Nepal. And in Nepal, we studied how the outreach program is undertaking, our patient flow, our instrument handling, and of course, I perfected my technique at that time. And then when we came back, we started doing the outreaches. And of course, we had a lot of challenges with our colleagues who did not know what this was all about, and our administrative staff. But we persisted and we endured. And now surgical outreaches in Ghana after so many years has become accepted. And out of that, we have progressed over the years because of the training we had from ACP. And now ACP, we have the National Cataract Outreach Program, which now is responsible for the main numbers in our cataract surgical rate in Ghana. And so I also did some training, as Ashiana said, in cornea. Again, my first experience with cornea was again with Jeff Tabin, when in 2007, 2008, he brought some corneas in his annual medical mission to Ghana. And I observed him doing corneal surgeries, and he let me put in a couple of stitches at the end. And that's how my training started. So it was a kind of sandwich training that I had. At the base hospital in Kofonochi. I did some time also at the Moran Eye Center in Salt Lake City in the US, Utah. And so Jeff Tabin and other international fellows, they used to come a few weeks, 1 or 2 weeks, sometimes 1 to 3 weeks for short-term training sessions. And then I had 2 or 3 long-term fellows coming to visit me at Bujak, Felma, and they stayed for 2-3 months. And those were really intensive training programs that I had. And that really developed my skills. And now we now have a corneal service in Ghana as a result of that. And because of that service being available in Ghana, the Faculty of Ophthalmology, at the Ghana College, as Ashiana mentioned, we are planning to start a training program for fellows in anterior segment and cornea. We've published a few articles out of our corneal services in the BMC. We've looked at how the perception of cornea transplant is like, and whether people are willing to do corneas or not. And we found that 70%, 30% of our people have never heard of corneal transplant before. However, 70% were willing to donate their corneas. What we need to do is to get a parliament to get a legislature so we can harvest tissues locally through advocacy. I've also had some training in FICO and FICO emulsification. Again, this was purely a sandwich program. It was a one-on-one training program. We had I started first observing FICO surgeries when Professor Crandall, as the late Professor Crandall, we all miss him so much. He used to come to Ghana for his annual medical missions in Kumasi. He started way before when I was a resident, and I used to observe him do FICOs. And he used to let me do a few simple steps in FICO surgery. And then I had 2 ACP international fellows visit for short, one of them visited for a long term, 1 month, and it was like every day we were doing FICOs, and that's how I developed my FICO training. So it's been a wonderful journey for me and for skills for FICO emulsification. Anterior segment surgery in Ghana has progressed because we transfer those skills, and we are now developing a training program where others will also be trained. Sandwich training program, which is what I had, has a lot of advantages and disadvantages. I mean, you have a training in your own environment. So definitely it means that there are better hands-on exposure. One-on-one, 100% focus and concentration on just that one student. And then you learn pathologies that are peculiar to your environment, not alien. And I've seen people who've gone to train and come and they find that the pathology spectrum here are a little different. Of course, the cons are that there's availability of faculties. It's difficult to get faculties to come for up to 1 or 2 months to do those intensive training. And of course, for the student also, sometimes there's a lack of focus, local distractions, family, and so as against being in the training institutions outside your country where you are totally focused, one might be distracted. So it's been a great journey. Where we are now, through the help of HCP and people like Jeff Tabin and others, we are now planning to develop, as we said earlier, a local training fellowship in anterior segment and cornea. And the HCP has agreed to partner with the Ghana College for that training program, bringing in international faculty to train our residents, and also to send our residents for clinical attachment and clinical observations outside the country. Thank you very much all for listening to me. Thank you.
Seth, thank you so much for your words. I met you just a few weeks ago in Ghana, and it's incredible what you are doing and how you have brought HCP with you in your heart into Ghana and really spread the word and made HCP so proud with the contributions that you are doing and continue to do. With that, we next have Dr. Gutetta, who recently completed his glaucoma fellowship at LV Prasad in 2020 and has gone on to become the residency program director at Jimma in Ethiopia. Dr. Gutetta, over to you.
So I think we lost Gutetta. So
Okay.
maybe we can go with David if he's ready.
Yeah,
Dave.
Dr. Rooney, are you here with us? Perfect.
Yes.
There he is.
Hey.
So Dr. Rooney is a recent fellow of HCP. We call him the Western HCP Fellow. And he completed his glaucoma fellowship before that at the University of Pittsburgh and is now the clinical advisor for Ghana. So living the HCP dream, living the HCP contribution to the fullest. David, over to you.
Thank you, Ashiana. Let me try to share a slideshow I put together. Is there a way that I can briefly
hold on.
open the screen?
Yeah.
Great. Okay, hopefully you all can see this.
Mm-hmm.
Fantastic. So my goal of putting together this slideshow is to briefly share with you why I'm so excited about the work that we are doing in Ghana with our partners, and hopefully give all of you previous fellows who haven't visited in a while some nostalgia with photos of familiar faces and places. Since HCP's initial partnership with Komfo Nokchie Teaching Hospital in 2006, our partners have steadily, our partnerships and number of partners have steadily grown, as has the impact of the National Cataract Outreach Program, which we helped launch in 2008. We sorely miss the steady leadership of the late Dr. Oscar Debra, but are so happy to have recently welcomed into our fold a new leader, Dr. James Addy, who is doing phenomenal things to continue to grow INCOP. To date, we have supported over 45,000 eye surgeries in Ghana. And this year alone, we project that HCP partners will perform 12,500 sight restoring surgeries in Ghana. INCOP and HCP's surgical volumes have steadily increased in recent years, with an understandable decrease at the beginning of the pandemic and a healthy rebound, which you can see in the graphics on the right side of the screen. We constitute a considerable portion of the cataract surgical volume in Ghana between INCOP and HCP. This may be a familiar location for some of you. This is, this is Corlebu Teaching Hospital in Accra. There, the number of residents, specialists, and professors have continued to grow. At last count, there are 33 residents and specialists who are quite busy taking care of patients from all over Ghana and neighboring countries with a remarkable diversity and complexity in pathology and care delivered. We're proud of the growth of sophisticated subspecialty care at KBTH and at CATH in Kumasi. The last trip I participated in a trabeculectomy-a-thon with a fellow in Ghana, as well as fellows from Nigeria who came in to learn how to do trabeculectomy at a high level. The pathology is as robust as ever, remains remarkable to me, even after a couple of years of making frequent visits. This is, of course, toxoplasmosis and me instructing residents on proper treatment for that. There are many familiar faces that continue to provide world-class care. This is Dr. Vera Esiman, staffing Pediatrics clinic, the busiest clinic, I believe, at KBTH. She's actually currently training her own fellow in country as well. And there are several newer faces whom we are also quite proud of. This is Dr. Kweku Kwarting, a KBTH specialist who is currently in India at LV Prasad, completing a highly competitive year of glaucoma training. Other HCP partners in the Accra area have also expanded their services. Just west of Accra, Dr. Bo Wiafe and his son Jeffrey have built an eye care empire. They are actively involved in training resident doctors in outreaches, and also have even expanded recently with the help of HCP into manufacturing and providing spectacles for Ghanaians. We have outstanding partners at Cape Coast Teaching Hospital, including Dr. Benedicta Apia Thompson and Dr. Nana Abrese, pictured here. We are so excited that Cape Coast Teaching Hospital recently broke ground, or cut sod, as they like to say in Ghana, on a new eye center with the financial support of USAID and HCP. This is going to be a cath-like anchor in that region of Ghana, with plans to expand not just the eye care, but also residency training in Cape Coast. And speaking of cath, things are going quite well there with a growing number of trainees. There are 4 senior residents, 4 specialists, and 12 junior residents at my last count. Our cath partners continue to make strides in delivering world-class subspecialty care. We hope to see a formal cornea and anterior segment fellowship launch in the next year or so, as Dr. Lartey just discussed. This is Dr. Tabin amidst a cornea transplant marathon during my year fellowship, where we did, I believe, a total of 26 transplants in a week, which has to be a record. I've really loved working with the residents in Ghana. This is me teaching CPC diodes laser to one of the residents at CATH. And this is perhaps a familiar sight for many of you. The CATH Big Cheese outreach bus continues to go strong. Even amidst the pandemic, it was active, taking me and a team from CATH to an outreach. And it continues to deliver care in remote areas multiple times a year with the staff and residents of CATH. This is actually on that outreach, me enjoying a Thanksgiving dinner of fufu, which was very memorable. It never gets old. These outreaches, just the joy is so powerful. And this is why I keep coming back. Wonderful partners, wonderful patients. And I hope that we can all bring you past fellows back into a collaboration with us. Thank you for your past work. Ghana is so exciting with the robust growth we've seen in eye care delivery over recent years. And I look forward to collaborating with you all as we cure blindness in Ghana.
Thank you, David. Can you make me the host again?
Yeah, I think I stopped the screen share.
I think you have to make me host.
Okay, I'll do my best.
Yeah. While we're switching that over, I just want to say thanks again to everybody for being on, and what a treat and privilege it is for me to hear everyone speaking. And I did mention that we started the first American Global Ophthalmology Fellowship in 2008 at the Moran Eye Center. We now have our fellowship through Stanford, but there are now several other programs, and it's an official specialty in the San Francisco match. So it's been really a great thing for me to see the American fellows, and sort of the partnerships, I think, is the key word for this morning. And Ashiana and Pam, thanks so much for bringing all the partnerships together, both our phenomenal American fellows as well as our phenomenal fellows from around the world. Thanks, Dave. That was a great talk.
Thank you. Just one more moment to sort through technical transfer issues. Forgive me, everyone. You think I've been on enough Zooms by now? I should have this on lockdown. Pam, perhaps I should just exit and re-enter. Is that an option?
You could, yeah.
All right, great. I'll be back. Thank you all.
Okay. All right, so next we have Dr. Gutetta. I think he is back, but in order to unmute him, I need David to make me the host or leave one or the other.
I don't want to end the meeting for everyone, which is sort of the dilemma I'm afraid I'm faced with.
Right. So just click on, see, if you go to my box, the three little dots, click on that and say make host.
If I could see that, let's see.
You see my box?
Yeah, I'm trying to find you, Pam. It's just not showing up as the dots. Here we are. And make host. There we are.
Okay.
Apologies, everyone.
No problem. All right, let me just find Gutetta. It's kind of like a board game here.
We have two more speakers. We have Dr. Gutetta and we have Dr. Meseret. So in case Dr. Gutetta is not available, we have Dr. Meseret ready.
Yep, I've got Meseret.
Perfect. Dr. Meseret, let me say a line about Dr. Meseret. Dr. Meseret completed his Sandwich Fellowship in Oculoplastics and Reconstructive Surgery in 2015. He trained at Duke Tilganga on site as well, and is now a trainer himself in Ethiopia. So Dr. Meseret, over to you.
Thank you, Ashiana. Good morning and good evening, everybody. As Ashiana said, I actually started my training in Germany with ICO fellowship in 2013. Then I went to Duke with Dr. Mike Richard in 2014-15. Then the same year in 2015, I went to Nepal, where I also had the chance to witness the earthquake in 2015. So after that, the long training was hands-on again here in Ethiopia with different HCP volunteers. Mike Richard, he came to us training every year doing surgery with us for more than 6 successive years. Dr. Morse Harstein from Israel, Brent Hayek from Emory University, Ania Gushin, Sarah Western, more and more people used to come to us until COVID disrupted everything. So I had the privilege to learn several skills from different experienced oculoplast surgeons. So after my training, I had I was the second oculoplasty surgeon in the country, so we had a lot of backlogs. We managed to reduce the backlog, even though the flow continued. As we expand the service, the number of cases continued to increase. Despite that, we were trying our best to reduce the backlog. We introduced different orbital surgeries, different reconstructive surgeries. So our residents are able to learn more and more techniques from their mentors. In terms of making the oculoplasty service accessible. Before introduction of HCP's training programs, oculoplasty was practically neglected, subspecialty in Ethiopia, like other, like trachoma and cataract conditions. But now, with the help of HCP, and as I was also the chairman of the National Residence Program Coordinators, now we have oculoplasty surgeons in St. Paul's Hospital, another facility in Addis Ababa. We have one in Bahar Dar, northwestern Ethiopia. We have another oculoplasty surgeon in northmost part of the country in Gondar. So oculoplasty is becoming, more and more accessible to the local community. And we also have started sandwich fellowships in cornea and oculoplasty. So far, we have trained the second oculoplasty surgeon. He is also in this call, Dr. Mulkan. He's doing a wonderful job. So he will take one region of the country. Again, we have other doctors already in training in oculoplasty. Dr. Sabla is now in Israel, who is also, I think, in this call. She will also join the team of oculoplasty surgeons in this country. So, gradually the service is expanding, the number of doctors is growing. So the national burden, I hope, will be, addressed. And with more doctors, doing more surgeries, the number of doctors who will be interested in joining oculoplasty, we hope will be increased. In addition to that, I'm also the focal person for ICO or examinations in Ethiopia. So every year, hundreds of residents are taking ICO examinations with the support of HCP. Many people, of our residents are, taking international and they're also taking courses, ICO review course in preparation with the help of international and local speakers. That's also helping us, upgrade the status of training quality in this country. So I hope we are moving in the right direction, and in the next few years we'll be much better off than what we are right now. In this regard, I would like to thank everybody, HCP, our mentors, our volunteers who used to come several times every year, who helped us, reach this level, who showed us different surgical techniques, who brought us equipment, supplies, their own items to help our patients. And I thank everyone involved in this endeavor. Thank you very much. Ashiana, I'm done. If you have any questions, I'm happy to address.
Okay, thank you, Dr. Meseret. I don't see Gutetta, so I wonder, in the interest of time, if we should just move to the discussion piece. Ashiana?
Has Dr. Gutetta come online?
I don't see.
Okay.
It comes and goes, so I wonder if we should move on.
So in that case, we are at the halftime, okay, like the Super Bowl. So like that, we're gonna take a group photo before we move on to the next segment. So if everyone can turn their videos on, okay, this is a reunion. And so we would love to keep this on for posterity. So everyone put on your best face. And if you have your HCP shirt, do let it show. Okay. All righty. Okay. 1, 2, 3. cheese. Okay, we have a few. We have 4 sections, so bear with me. 1, 2, there's Netta. 1, 2, 3, cheese. Okay, okay, one more. 1, 2, 3, cheese, and one more section. This is lovely. 76 people here. 1, 2, 3, cheese. Beautiful. We are going to find a way to make it collageable with everyone. So that was really, really great and really very touching, very informative by all the fellows. Next segment is a very, very important one. It's a discussion that's led by the great, there's not enough words to say how wonderful this person is, Dr. Matt Oliva, who came into contact with Dr. Tabin and Dr. Rui in 1998. And he told me that's all he wants me to tell. But I can tell you that he is just such a humble soul, and he really exudes service with love in action. And I'm just really, really honored to get the chance to work with someone like him. Dr. Oliva, I'm going to hand it over to you to introduce the next segment.
Thank you, Ashiana. It's very kind of you. Thank you, Pam, for organizing this. And thanks to every one of you for being here. I mean, this really just cements home the worldwide community that we have all created, and everyone has, I see big smiles on their face thinking about their own training, and then also about the training that they've given and the training that they're going to do in the future. And I think this forum, this meeting, this group is really critical, because really all we have is each other to carry forward our dreams for our regions. And we've been lucky in that we've always benefited from the leadership and the compassion and the sort of hard work of our friends in Nepal. And so many of you have trained in Nepal and have benefited from the system that's been created by Dr. Ruud, Dr. Gurung, all the sort of original people that have been, Dr. Raba, I see, is on here, and Sanyam, and all our great friends in Nepal. And the way we put together these fellowships in the past has really been opportunistic. And what makes HCP unique is sort of the doctor-to-doctor communications and constructing fellowships that really meet the needs of people in their own unique setting. Everyone's setting is different, and every training probably needs to be a little bit different as well. But we're kind of up against the fact that not everyone can have a chance to go to Nepal and participate. And we're kind of at a watershed moment, I think, where you see that trainings now oftentimes consist of people going to Nepal for a while, and Israel or Canada or the United States, and increasingly, as you've seen from Dr. Meseret and Dr. Lartey, we're trying to support more training solutions in Africa, and Ghana and Ethiopia are sort of serving as epicenters for training in regionally. But to be honest, we don't have enough training spots for all the great young doctors that need to be trained. So part of the job here today is to think about how we provide more opportunities for fellows, and then also how do we support our fellows that have come out of training that have challenges, whether it's equipment or they need additional training or different skills, and how do we connect all our sort of vast network around the world of people that want to be involved to support our fellows. And I'm going to plug Ashiana and Pamela here. Before at HCP, we've never really had two dedicated people that were only focused on training. And Pamela is in that role now, many of you know, and we're also lucky to have Ashiana Narayani, who's a cornea specialist who has dedicated her life for training and who is based in India and also the United States, but is really a well-connected person that can help make these connections. And whether it's you want to get involved or you want you need something, we have sort of a person that can be at the epicenter of that now. So I want to invite a couple people to say a few things. Dr. Sadiq Taiju, I think, is here from Ethiopia, and Sadiq has been really instrumental in setting up. He trained in Toronto. He's a pediatric ophthalmologist, and then has been the chairperson at the Addis Ababa University. Has set up 3 fellowships along with Dr. Meseret in oculoplastics, cornea, and glaucoma. And I want to just share kind of what you, Sadiq, if you can share a little bit about what you think are the next steps to create more training programs in Africa.
Thank you so much, Matt, and hi, everyone. Good morning, good evening, everyone. I'm really happy to see you, everyone from all over the world. Those names that I know by names or by their contribution. So thank you so much, and glad to see you all. So the subspecialty training maybe in the Ethiopian history, it has been only for the past 2 decades, which was introduced through the Orbis. So the first platform was a kind of sandwich program where trainees, they move to US and have sort of observation for a while, then they return back with their consultants and do hands-on training in Ethiopia. Then for 15 years, there was no opportunity for the new emerging young ophthalmologists, a possibility of fellowship training in the areas of ophthalmology. Then, initially HCP was on high volume cataract surgery. Then, at the same time, start to support majority of the young ophthalmologists by providing training in Nepal and also in US, like what my colleague Dr. Meseret was saying. Those people who was trained through the opportunities in through the HCP, they came back and we start to have our own training. So what I see from the Addis Ababa University perspective and from the Ethiopian eye health workers perspective, we have a very good opportunity right now and a very good development. Since 2020, we started the glaucoma fellowship at Addis Ababa University, a 2 years program in collaboration of the University of Alberta. And now it is a fully 100% AAU program. And then with HCP, we started on plastics and cornea sandwich fellowship program, Ethiopia, Nepal, and US. And through that, now Sablo he is in Israel. Mulugeta already finished his fellowship program and now joined our department at Addis Ababa University, and a lot to come. So according to our 5-year strategic plan in Addis Ababa University, the plan is to add more fellowship programs in plastics, in retina, and also in pediatrics. So regarding the pediatric ophthalmology fellowship program, we have this program will be the AU's fellowship program, and we are working with the University of Toronto through what we call the Toronto Addis Ababa University academic collaboration. And then, the kind of thing that we are thinking with the PEDS fellowship program is to attract ophthalmologists not only from Ethiopia but throughout the region. There are very good experts, like I see my best friend from Ghana, Vera, and we would like to incorporate all those people's all experts in the field. And the other one is hopefully we're going to start retina fellowship, starting with a sandwich, and hopefully the plastic and the cornea programs will be full-fledged 2 years fellowship programs in the coming 5 years. That's according to our strategic plan. Just to say a few words on the main challenge regarding the training is maybe Matt was mentioning, the supplies and consumables. These are of the the ophthalmic equipments. It becomes a big challenge not only for the service provision, but also for the training, especially in the areas of retina. It becomes a big issue. Otherwise, the kind of opportunity which was created through the HCP, people from Nepal and US, they are especially with Jeff and Matt, people are coming and helping the training and establishing wet lab and others. So besides not only the training, we are also encouraging and improving the quality of training also to the residents. We have a wonderful wet lab curriculum, which is implemented in 5 of our universities. We have wonderful opportunities among our 5 universities. So thank you so much for the opportunity. I hope in the coming few years, the Ethiopia will have our own fellowship program. Thank you.
Thank you, Sadiq, and congratulations on all your great work and your team. Do we have Pam and Ashiana, do we have a moment? I know Dr. Olenaya from Nigeria wanted to say a few words. Do we have time to let him just give a brief update from Nigeria and how his training and his training programs are progressing?
Absolutely.
Hello, everyone. Good morning, good evening. Can you hear me?
Yes.
Can you hear me? Oh, good to see you all. I'm grateful for this opportunity to be in this meeting. So just to say, I came in contact with the HCP when Dr. Tevin came to Nigeria, northern part of Nigeria, in my final year of fellowship. And then we got talking and he offered to help me because he asked, what do you want to be? I said, I want to be a glaucoma subspecialist. And he said, oh, I'll get you to do a double fellowship in glaucoma and cornea. I get to go to Nepal and go to Moran. And well, 4 years after that, I was in Nepal. I had my short course in management under Dr. Suman. And that was actually the beginning of my subspecialty training. In 2018, I was with Dr. Crandall at the Moran. So promise made was promise kept. In between, I was able to have a full fellowship at the LV Prasad. So I'm a glaucoma subspecialist and I practice in Nigeria. So here in Nigeria now, I head the glaucoma unit of the National Eye Center, where I'm able to be in contact with trainee ophthalmology residents, other staff, and a lot of training going on. So in recent time here, we've started looking at subspecialty training in my country, and I'm glad to say because of my presence in my center is one of those approved to start subspecialty training in glaucoma. Interesting, but not to say we don't have our challenges here, but things are going on, and I believe it's because of inspiration from Dr. Tevin, and there's all along it's been encouraging. It's been a good, as it is now. I would say, well, in my region, I'm the only one that does GDD device implants, licensed to do GDD device implants. And then I get to train all these patients. So it's been nice. I hope going forward, what we will need to do, I see that the area of challenge may be pulling patients together so that we can have the volume needed for deep and proper, thorough subspecialty trainings. This is likely to be an area of challenge, and I know the HCP may be able to help in that aspect. We really need to have patients. Most of these patients will come to the hospitals we already have because of the financial bottlenecks and all that. So I believe we can, there can be an arrangement where we can get in this patient, because the subspecialty trainings I know need volume, but the sandwich program, which some of us have benefited from, they have all been good. At least they've served our purpose. But we're going to move to having subspecialty training on ground. We're going to be sure to have enough volume so that again we can shorten the time, the duration for these subspecialty trainees. Thank you very much. Thank you. Thank you. I know.
Thank you so much. And I think I love all these slides. It really just warms my heart to see everyone doing this work. And I love the idea, Dr. Ruid, of having all of us together to really focus on this. I think we really need everyone's help in this room to continue to propel our training programs forward. So I'm going to turn it over to Ashiana and Pam and let them close.
Matt, thank you so much for that. For those that know me, I think one of my favorite things to say is you got a free ticket in here. All right. This is the inaugural Fellows Reunion and Workshop. And it is a very historic time, as Dr. Ruid said. It's a very memorable time. It is a time for us to remember where we've come, what we've received from HCP, but it's a free ticket into the workshop, but it's not a free ticket out. We have a lot of work that needs to be done. And as Matt said, we can't do it alone. We only have each other. And so with that, we want to move forward as one family, as one unified team across the world, passionate about one thing, and that is to cure blindness. And how are we going to do that? We're going to do that through everything that you're already doing in your part of the world. But when we bring each of us together in the curriculum development, in mentorship and teaching of future fellows, in terms of actually understanding where the surgical needs are, the super specialty needs are. We have a lot of great things in the works, from a global HCP clinical series that we're looking forward to start, to creating and formalizing the curriculum from the Sandwich Fellowships to the American Fellowship, and we want your help. Each one of you is going to receive a Google form, a Google survey after this, and we request that by Sunday, if you can take a few minutes out of your very, very busy schedules to fill that out for us with your honest feedback of your fellowship, of how we can help you. As Matt said, Pam and I are dedicated to you full on. That's what we're here for. And we've already, since I have joined HCP, I have been in touch with the fellows, with the faculty on the ground, and I have also been in touch with the residents who are going to be the future fellows. And so we have a lot of work ahead of us, but we are here for you. It doesn't stop when you finish your fellowship, it just begins. So if there's something that we can do to help you further your inspiration, further your commitment to global ophthalmology, to curing blindness, do not hesitate to pick up the phone, to email us. Pam is going to put our phone numbers and our email addresses on the chat group. Do not hesitate to reach out to us so that we can be instruments in your path of success. With that, we thank you very much for taking the time to be with us today in the middle of your day. And we look forward to hopefully a reunion at the AAO and the second annual Fellows Reunion and Workshop to come in next year. But before that, stay tuned for many more opportunities where we're going to lean on all of you to be teachers, mentors, and guides through the virtual platforms as well. Thank you very much. And a very, very special thanks to Pam. It is only with Pam that we were able to get such beautiful photographs together, that we were able to get all of you together. She is truly the mother hen that for 19 years has been there. And from the short time that I have joined, I have seen how committed she is to each one of you in your training. So very, very, very much so. Can't say enough gratitude to Pam for being there. Thank you to each one of you for being with us and looking forward to many, many more conversations to come. Thank you.
Thank you, Ashiana. And so we'll follow up with the emails and the phone numbers in an email to everyone along with the survey. So I think we'll just end with some inspirational music.